She came to Samaritan Health Services in 1995 and was named CEO and Vice President of Health Plan Operations in 2005. And she has served as the governor appointee of the Oregon Medicaid Advisory Committee and was chair of that group from 2002 to 2004. And she holds a bachelor's degree in healthcare administration from Oregon State. Jeff Luck is an associate professor of healthcare and health management policy at Oregon State, a member of the Metrics and Scoring Committee for the Oregon Health Authority. His research focuses on performance of healthcare delivery systems, and he works on policy analysis and improving the quality of care and implementation of new management practices. He comes to OSU from UCLA, where he was in the School of Public Health before coming to Corvallis, and thinks that he's going to get used to the rainy weather we're hoping that we still have here in Corvallis.
So I am here today representing Intercommunity Health Network Coordinated Care Organization. We actually serve Lynn, Benton, and Lincoln counties in terms of the Medicaid population. Intercommunity Health Network has actually been serving the Medicaid population since the inception of the Oregon Health Plan in 1994, and I have been working with that population since 1995. So we have been very much engaged in all of the reform that Governor Kitzhaber has been working on over the last 20 years and are very much engaged in this next phase as we move forward as well. Under the Oregon Health Plan, as you heard Jeff talk about, on the left is really where we are today. There's a family down there in the bottom who's kind of confused and looks a little sad. This is an Oregon Health Authority slide, by the way. Source. So just for, and it talks about the piecemeal way that care is delivered in Oregon as it relates to the Oregon Health Plan or Medicaid recipients. So right now you have one plan that gives you your mental health services. You have a member handbook for that, an ID card, an 800 number, a crisis line. You have one plan, or before August, you had one plan that gave you a physical health benefit, your doctors and your nurses in your hospital, and a different member handbook, and a different ID card, and a different phone number. And you have a third plan for dental. So part of this new reform that we're in that started in August, and we were one of the first 8 coordinated care organizations to be certified, was to really bring all of those 3 disparate pieces into one funding stream, which would then, of course, force or help encourage the coordination of the care between all the pieces together from a technology perspective. Obviously, that's key because patients and families aren't always going to remember where they went or what they got, and bringing that together is huge. There's a huge focus on health disparities and health equities. How do we make sure that we are culturally competent in terms of meeting the needs of our members and creating documents that are that they understand. As our medical director put it last week, living room talk. You know, we need to make sure that however we say something or present something is something you could hear in your living room and understand. If we talk over the heads of our members, they're not going to engage. And so making sure that those pieces are there. So those are the main elements, and in order to achieve that, we have created a delivery systems transformation team, which has 4 pilots that are part of it. We have a pilot in Benton County that's working with Samaritan and the Corvallis Clinic and the federally qualified health centers of Benton and Lynn County, the county delivery system, to come up with a way to make sure that we're in the patients that are assigned to their primary care, that they know who their primary care provider is, and that their doctor knows that that's their patient. So it's kind of a fundamental base one to make sure that we know who's where and they know who's where, so that as we build these homes, we're building them around the right people. Because if my system says, Jeff is my primary care, and so I send a bunch of information to Jeff to say, here's what you need to do, here's what we know about Kelly, you need to fix all this, and I've been seeing Julie over here, I'm not going to get anywhere.
So I'm Biff Traber, and just to follow up on that question, Corvallis Family Medicine has a contract. What is the process for providers getting contracts or getting selected? Is there a selection process, or if they get a Oregon Health Plan patient walk in the door, do they then automatically get a contract with you, or how does that?
So because we built our CCO on our existing delivery system, we've actually had a contract with almost every single provider in the Benton and Lincoln counties for the last 5 or 10 years.
Does that mean that virtually every provider in the Lynn, Benton, Lincoln area accepts Oregon Health Plan patients? That would be very unusual in the rest of the country.
Yes, We have worked really hard to make sure that that panel is available, and there are certain, some providers are closed. If a provider is closed to new patients in general, regardless of insurance type, then they're still closed to Oregon Health Plan. But in general, we contract with 99.9% of all providers in our service area.